Joan Lunden. Welcome to the Small Steps to Help You Manage Your Diabetes series. This is episode 4, Learning the Ins of Insulin. You've probably heard that diabetes is a progressive disease. It can change over time as your pancreas loses its ability to make enough insulin. So your particular therapy may change as your diabetes changes. Now, many people with diabetes see this normal progression of the disease as a personal failure. But the fact is that this is just not true. You're actually being smart in reacting to the changes in your body. Now remember, before starting or changing your diabetes medications, please consult your healthcare professional.
My name is Ron, and I was diagnosed with type 2 diabetes 8 years ago. I've done a pretty good job over the years of managing my blood sugar levels, but you wouldn't know it from looking at the numbers now. They've been getting inconsistent lately. And I guess I'm a little disappointed because, you know, I haven't done anything different, but the results just seem to be getting worse. I have an appointment to see the doctor today, so we'll see what he says. Morning, Doc.
Ron, how have you been?
Oh, I'm all right, Doc, thanks.
Well, thanks for being patient. I'm sorry I'm running a few minutes behind. Have a seat here.
Oh, thanks.
So how are things going at home?
All right.
Thanks for going to the lab, getting your blood work done early. Appreciate it. We got your results back. So how are your blood glucose levels?
They're kind of up and down. You know, I don't know what's going on. I've been doing the same things I've done for years.
Yeah, I know. Blood sugars, they go up and down all the time. Do you have your logbook with you?
Yeah.
Oh, great. Let me take a look at that. Well, your blood pressure looks good today, I'm glad to tell you.
Great.
We got your cholesterol test back, and it's still a little higher than I'd like. Okay, I see what I need to do here. Let's talk a little bit about your blood sugar levels. You know, sometimes we need to change your treatment to keep your blood sugar under control. So tell me, Ron, what kind of readings are you getting after you've had a bite to eat?
Well, after meals, they're still kind of inconsistent. Sometimes they're close where they need to be, but they're going up.
Do me a favor. I'd like you to start taking notes. Your logbook could be a big tool for us. I'd like you to jot down what you're eating and any significant activities you might be doing, and bring those into me.
Okay.
You know, my big concern is the level of your blood sugar readings. Overall, they're still too high, and I need to start you on insulin today. And we've talked about that in the past.
But I've worked so hard to keep everything the same.
I know you have, and you're doing a lot of the right things. But remember, diabetes changes over time, and sometimes we need to change our treatment to keep your sugar levels under control.
Okay.
Many people with diabetes think that starting on insulin means they fail. Even though they're trying to do all they can, they still think they're failing. The fact is, most people with type 2 diabetes eventually need insulin. Right now, we're just looking for the best way to keep Ron's blood sugar levels as close to normal as possible. His A1C levels is close to 9%, which means his average blood sugar is about 240. My concern is that this is higher than he's ever been in the 8 years we've been seeing each other. His other medicines aren't doing enough for him any longer. That's why it's time to start him on insulin. I reminded him not to lose sight of the fact that he's been doing most of the things he needs to do by eating well and staying active. But his diabetes is progressing, and we have to respond to this. So Ron, I'm going to ask a diabetes educator to come in and work with you. Okay. Her name is Debbie. She's a real nice lady. You're going to like her. She's going to teach you and show you how to take your insulin, and she's going to answer any other specific questions you might have.
You know, Doc, this is kind of scary for me.
I know, Ron. A lot of patients feel that way in the beginning, but you're going to see how... It seems like everyone who starts insulin is afraid at first, but this is something he can do. He's done a great job at monitoring his blood sugars daily. Ron will be thrilled to see his blood sugars improve as we adjust his insulin doses. Now, to help us understand just how his blood sugar is changing, I'll ask him to start checking his sugars more often, at least 2 times a day instead of just once, by adding a mealtime sugar reading. And since he's starting insulin, we'll begin by having him check his blood sugars on a specific pattern to see how the insulin is working and to learn where we need to make adjustments. I'll write down this pattern on his logbook. Sometimes he'll check before meals, and sometimes 2 hours after he starts eating. Debbie will give him more information on how to do this. After I talk with Debbie about the doses of insulin we'll be starting with, she'll go in and discuss it with Ron. Then she and I will be looking at his blood sugar readings every few days to tell him how to make changes until his next appointment in about 2 or 3 months. Since we also want to monitor his physical activity along with what he eats, we'll have him fax or email over the pages from his logbook. Then Debbie can call him if we decide to make any adjustments to his insulin doses. By the time he comes back for his next office visit, we should have made a lot of progress.
Anything else?
Yeah, I'd like you to continue following the same meal plan you've been following and keep up your exercise routine. I'm really happy about that.
All right. Thanks, Doc.
All right.
Listen, can I ask my wife to come back and help me with all of this?
That's a great idea. I'll have Cindy bring Joanne back in just a couple minutes.
Great.
I think it'll be a good idea for her to listen to all the things we're going to go over. It might help you when you're home.
All right. Thanks, Doc.
You're welcome. See you in a bit.
All right.
Okay.
Thank you. Well, it's not good news. Dr. Aguilar says he wants to start me on insulin. And that's frustrating because, you know, I've done everything he's asked me to do, but my numbers have gotten worse. And I just don't understand. I've done everything I've always done, and why the change? I mean, he says it's you know, it's a progressive disease, but insulin? I mean, that means needles and injections. And, you know, my Uncle Mike, he had diabetes, and he lost a foot. I mean, and he was on insulin. So is that what's going to happen to me? And what about the inconvenience to my wife? I mean, she loves to travel. We can't travel, go out, or anything. I don't know. I guess I'll just have to do what I have to do.
Ron?
Yes, hi.
Debbie Hinnon.
Nice to meet you. This is my wife, Joanne.
Hi, Joanne.
Nice to meet you.
You too. Hey, I'm Debbie Hinnon. I've been a diabetes educator for over 30 years. As a nursing student, I got to go to diabetes camp, and the kids were amazing with their diabetes self-care skills. It really inspired me to work with people, and I know how difficult diabetes is. It's frustrating, it's tough, it's a lot of work, and it really has inspired me to try to help people develop skills so they can live effectively with their diabetes. Okay, for starters, can I take a look at your logbook?
Sure.
Thank you. This is good. You keep very good records. I see you've been checking your blood sugar once a day?
Well, that's how often I try to check. And now the doctor wants me to start checking at least twice a day. Now, is that why I have to take insulin now, that I haven't been checking enough?
You're starting insulin because your body isn't making enough insulin, and your cells, the muscle cells and fat cells, aren't responding properly to the amount of insulin you do make.
Oh.
It's not because of anything you did. Most people with type 2 diabetes need to take insulin at some point if they want to stay in good control. It's not a sign of failure. If anything, it's a smart response to your body's changing needs.
So what happened to me that I have to start taking insulin now?
Well, let's go back to the beginning. When you have type 2 diabetes, you have a gradually declining ability to make enough insulin for your body's needs, as well as something called insulin resistance. Insulin resistance means your cells don't use the body's natural insulin effectively, so the pancreas has to make more.
Lazy cells, huh?
Well, your pancreas has been working overtime and it's starting to get tired, but your body still needs increased amounts of insulin, so your pancreas has to work more and more.
That's why they say diabetes is a progressive disease, right?
Exactly. So if you're not getting enough insulin, your cells don't get the energy that they need.
Is that why I'm always tired?
Well, could be. Think of insulin like a key which unlocks the door to the cells, letting the glucose in to provide fuel for the cells. If your cells aren't using the insulin you make as well as they should, the right amount of sugar isn't getting into the cells and your blood sugar levels go up. And that's why it's so important to keep track of your blood sugar levels. If your blood sugar stays too high, your blood vessels and nerves could be damaged. Actually, by maintaining good control of your blood sugar, you may be able to prevent some of the more serious complications like eye problems, kidney damage, heart disease, or even losing part of a limb, which I know Ron is concerned about because of his uncle. So, taking additional insulin is an important way to help keep your blood sugar under control.
Well, what happened with all those pills I've been taking? I thought they were supposed to take care of everything.
Well, as you know, there are several types of medicine for diabetes, and Dr. Aguilar may want you to keep taking some of them. What you take depends on your medical needs. The ones you've been taking help control your diabetes, by promoting the production of insulin or by helping your body use the insulin it's already producing more efficiently.
Well, if there are so many different kinds, why do I have to add insulin?
Ron, your pancreas just isn't able to make enough insulin anymore. Ron's diabetes has progressed. What we're going to do is use a combination of medicines that are right for him. And Ron is going to continue with his meal plan and his physical activity routine. These things together will help keep his blood sugar levels as close to normal as possible. And checking sugar levels more often is just another small step he can take to help make better blood sugar control possible. The overall idea of insulin is to help control high blood sugar levels at all times of the day and night. One type of insulin is long-acting or basal insulin. It helps to regulate your blood sugar in the day, between meals, and during the night. Another type is mealtime or bolus. It is a rapid-acting insulin. Your blood sugar levels respond to what you eat and can rise quickly after meals. Mealtime insulin is important because it helps to quickly control those blood sugar spikes. Dr. Aguilar wants to start Ron on an insulin that's a mixture of mealtime insulin and a longer-acting insulin that starts working quickly after he's taken a dose, and then it also lasts for several hours.
So, taking this insulin, that means needles, huh?
Oh, he's never been a big fan of needles.
Believe me, it's not as scary as you think. You're probably thinking of those big injections from the movies, or when you used to get vaccinated as a kid.
Yeah.
Here, let me show you something. This is an insulin pen. It's a pen that comes already filled with the insulin you need. It's all in there.
Well, it's not as big as I thought it would be. It looks just like a pen. So I could carry it around in my pocket, right?
Pretty convenient, right?
Yeah.
It allows people to take their insulin wherever they go and take their dose right before they eat.
Huh. Well, it's not as bad as I thought it would be.
A lot of people say that.
I thought going on insulin would mean I'd lose my independence, that I'd have to stay close to home all the time or something like that.
Many people with diabetes believe that, but it's just a myth. Like I said, this pen comes pre-filled with insulin, and it's pretty easy to use. Can I show you how it works?
Oh, sure.
Okay. First, you'll remove the cap, then attach the needle. Look how small the needle is.
It's not so bad, Ron.
Yeah.
Oh, yeah?
So after you remove the cap and you put on the needle, compare it to this. Pretty small.
Yeah.
Okay, so let you have a chance to practice with this. In fact, let me just let you start from the beginning. Take the pen and let me hand you a pin needle.
It's been about 3 months, and I'm back for a checkup, and I feel great.
Yeah, he's had a great attitude about it all.
Yeah, I've been exercising more
That's
and
right.
eating right, and
I've been keeping him on that diet.
she's been good about it, and I'm actually excited, to see the doctor. Hey, Doc.
Hey, Ron, good to see you.
Nice to see
Have
you.
a seat.
Oh, thanks.
How you been?
I've been great.
Good. It's nice to have you back. Haven't seen you for a couple months. How things going?
Things are going terrifically.
Oh, wonderful. Oh, a logbook. Well, you look pretty happy. You must be pretty pleased by your results.
Yeah?
Well, let's see how you're doing. Wow, these are much better. Wow, and these are a lot closer to the targets we set before. I'm impressed, Ron. Good job.
Thanks.
So how's your activity level? Tell me about that.
Well, I've been walking a lot more now that the weather's nice, and I'm doing a lot better with my eating. With me, the main thing was portion control.
I know it's tough, Ron, but it really helps. In fact, your A1C, when we checked it again, has come down, and your cholesterol has also improved. So that's great news.
I read somewhere that exercise lowers cholesterol, and so I did a little more walking.
Excellent.
Yeah.
Your positive attitude about your diabetes is great. Oh. Any new thoughts about insulin now that you've been on it for a few months?
Well, actually, yes. When you put me on insulin, I got really scared, but Debbie cleared up a lot of my worries.
She's great, isn't she?
Oh, she's terrific. She made me realize that insulin was another tool to help manage my diabetes. And, I know I'm a big part in managing my condition, and the insulin pen makes it much easier than I expected.
Pens work for a lot of my patients. Let's take a closer look at you, and then we'll go over your sugar levels in more detail, see if we need to make any further adjustments.
Okay.
Okay, great.